Hey everyone, I'm Jessie Whittish with Kentucky Youth Advocates. It is great to see all of you for part 2 of our conversation with DCBS. And if you're just here for the first time, you can catch up with the recording from last week after you participate in today's forum. So you're not missing anything. And related to that, we are recording today's forum to share as both a video and a podcast. So we do ask that you stay muted, but please drop questions in the chat. The DCBS team has invited several representatives to be on today's forum to answer questions. So if you have a question, please drop it in the chat and try and get that answered either during the forum or after the fact. So with that, I'm going to turn it over to Dr. Terry Brooks.
Hey, thanks, Jessie. I'm sure if you have joined us very frequently for the 115 forums we've had, you know that Jessie always asks some uplifting question, and then I try to provide reality. So Jessie, I don't want to mess you up, but my favorite fall smell is the sweat from shoulder pads. Okay, how's that for I don't think there's a candle that they don't make a candle with that, but we'll go ahead. So as we always say, whether this is your very first time or whether you have been with us for all 100 and whatever forums, we're so glad to have you. I'm going to cut to the chase. You know that last week we started a 2-part conversation with DCBS leadership. Last week we included Secretary Friedlander as well as the commissioner. And what we were doing is really trying to make sure that you all as partners heard the direction of where DCBS was going and growing, both what would it mean to build a 21st century agenda. And in order to build that 21st century agenda, we've got to think about building a 21st century workforce. I just want to say very publicly to thank Commissioner Marta Miranda-Straub, the fact that DCBS is transparent, the fact that they have said to us that they want to have a dialogue, not a monologue. They want to hear your questions as critical friends. We want this to be an authentic conversation. It's not a sell you a used car or a show and tell. So I just want to thank the commissioner, secretary, their senior staff for that kind of attitude, which I think we would all agree is as refreshing as it is unique around that organization. So I'm going to kick this to Marta, and her job is to architect the rest of the forum. We have invited some key thought leaders who are our partners around these issues to join with the commissioner and her staff today and engage in what I expect to be a very open, very iterative, conversational style forum. Again, thanks so much for joining. We always appreciate and need to acknowledge that this could not happen without the support of Aetna Better Health. And so thanks for being here. Commissioner, again, thank you so much for both your brain and your heart. Today, especially, both of those are important for us to hear the details for sure, but also to sense your attitude of openness to real input. So I'm going to give it to you and take it away.
Thank you. Thank you so much, Terry. Thank you, KYA, as always, for gathering our friends, our partners, and to help us communicate to you where we are, where we're struggling, what changes we're hoping to make, and where we need your support and help. We can't do this by ourselves. No one can, but especially right now. So I want to give a big shout out to Lisa Dennis, our Chief of Staff and Deputy Commissioner, who is the wind beneath my wings. And then Jason Dunn, who oversees all of our economic support programs. Krista Bell, who's leading the effort to build the infrastructure for a primary and secondary prevention division that will report to the commissioner. Mary Carpenter, who is the Director of Protection and Permanency. Not an easy job either. So, and really important, and our amazing Dr. Sarah Vanover, who is over our child care. And this is the band. We are the band, you know, so I brought my top leadership here so that they can answer questions, and also so that you would see them and they can be as honest and as vulnerable and as open as I hope to be. So thank you so much. I'm going to do a small PowerPoint and then open it up for Terry and you all, just to give you a context of where we are with workforce. So the first piece is we really want to build a healthy and resilient organization. That's the overarching goal. In addition to updating it to our 21st century, we want to shift culture and climate using the culture of safety, et cetera, et cetera, et cetera. So the overarching goal around workforce is to build a healthy and resilient organization and a healthy and resilient workforce. Next. So here are key issues impacting the DCBS workforce right now. We have diminished capacity. We have folks who could retire and decided to retire. So we've lost a lot of expertise with a lot of years. And what we have primarily is young, inexperienced workers in the front line without the support of those with the organizational history and the experience. So they're there. And in addition to that, there's the actual numbers. Folks are like everybody else. We've always had a turnover issue in DCBS. We've always bled in that area. The work is really hard. Just like a commissioner should last usually about 18 months, so does an advocate in dealing with trauma. That's where all the research says about them. So what I want to say to you is that folks can make more money working at a box store right now than it is working for us without the trauma. And like the rest of us, we're struggling with staffing. So we went from bleeding as a result of turnover to high retirement in all of state government to now hemorrhaging, particularly in our front lines. We have both traumatized staff and clients, the uncertainty of living with COVID, the kind of highly reactive and expanded cases that we're seeing is creating beyond the secondary trauma, just that kind of, we don't know what's going to happen next in regards to COVID, in addition to the multitude of people that need a lot more assistance than ever have as a result of COVID. We had done really well at lowering caseloads. Our goal is between 15 and 20, that's best practice. Some of our staff are 40 and 50. We do not want that to happen. That happens because they have to take the caseload of those leaving in order to continue to see families. So we're back to high caseloads as opposed to the steady stream we were going down with that. We have the continuum. This is part of my expertise and why I was brought here. We go from chronic fatigue to vicarious trauma to compassion fatigue to secondary trauma and to impairment. That's the continuum. And we can help ourselves and our staff get off at any point in those stages, but we need to know what they are. And that's exactly where we are. We're in chronic fatigue and we are traumatized. Chronic, there's a long history of low salaries and no cost of living raises and no raises. That continues to be the struggle. We put it in our budget last year, the governor approved it, and the legislators did not do an appropriation, so we were not able to do some basic pieces that we wanted to do around salaries. We're not giving up yet, though. We have ideas. We have a lot of work to do around coaching and mentoring of staff, which is really needed. And we have had a lack of institutional support for self-care. And we have a pretty toxic culture and climate. People, are overwhelmed, they're reactive. The response to some of the community, to our client, to our staff is brutal. Some of those calls are brutal. Some of the media pieces are brutal. And there's a lot of misconception out there. So I hope to recalibrate some of that. So here's how we're responding to the DCBS staffing workforce crisis. We're working on an alternative response, meaning having smaller caseloads with experienced folks who then can be content experts for our younger and less experienced folks. We're working on differentiating between high risk and low risk cases, and then matching that up with experience. We're building a trauma, resilience, and engaged healing as a primary focus, not for our clients, but for our staff. We've always done the trauma-informed care since it became best practice, but we haven't used that language and that model to talk to ourselves and to think about what we need as a workforce. We have started a prevention collaborative facilitated by Krista Bell with many of you on here because we do need to move towards prevention. All of us do, and specifically DCBS. We can no longer be the emergency room for the state. We are moving training away from academia and make it a skill-based and with behavioral anchors with Dr. Anita Barbie and EKU. And we have designed a DCBS certification that is skill, competency, ethics, and quality based for all our staff that will begin next year. And we're very excited about that. So if folks have a degree in social work or they have a degree in sociology, they should have the same skill set, and our performance evaluation forms will reflect the new training. We are working to better support supervisors regarding staff development and being able to coach and help with planning, secondary trauma planning, and being able to work with teams on having an appropriate response, really moving self-care out of the bougie, lucrative area to it is part of our work to have comprehensive, radical self-care as an organization because of the work we do. We really are looking at a coaching model as opposed to a management model, and we're beginning to work with all of our supervisors and directors on that. We're advocating for a living wage with the governor and with the legislature. A lot of our clients, a lot of our staff meet SNAP criteria, and our clients as well as our staff. We established work groups to get insight from frontline regarding alternative ways to support the workforce. So not us thinking what staff needs, but staff telling us what they need and then brainstorming and coming up with a plan. My motto is nothing about us without us. So really making sure that I stole that from the disability movement because I love it. And the having the voice of frontline in creating solutions for frontline is crucial. We've also added, which I will add later, trusted advisors, which is our existing or alumni clients and partners to help us in the same way. We are conducting virtual forums. I've done that since month two that I got here, open, accessible, ask any questions, let me respond, tell me what it's like on what you need, and then come back the following month in a feedback loop and answer whatever questions they have that I or Lisa did not have answers for. Modeling accessibility and transparency, breaking down some of those barriers so that there is an actual open door and nobody gets in trouble for emailing me, which I'm really relieved about. So that's shifting. Next. So these are the responses that I'm hoping we can talk about and that you all can consider in regards to what we need. Acknowledgement and advocacy of the work of the department. It is not okay to assume and feed that our staff actually steals children like we're being accused of in the media in the bluegrass area. There's lots of check and balances, and only a judge can consider whether a child needs to be removed and put in our custody or not. That's not anything that we do on our own. So correcting those assumptions and realizing that we have check and balance, and realizing that the work of the department is hard. And right now we specifically need support and grace from everyone. Support, as you speak with legislators, support a living wage for our staff and the additional support that we need to taking care of secondary trauma systemically and structurally within the workforce. That means capacity as well as expertise to be able to empower the staff that we have. Asking for your grace and patience with us. Support our message. While DCBS is the lead child welfare agency for the state, the child welfare belongs to all of us, and we are one with you. And we need to put the C back in, and the Prevention Collaborative is doing that. My conversations with all of you is doing that. We need to do that more. And we need you to be walking this journey with us, not just because we write a grant or you administer a service that we need, but real partners, real engaged, transformational partnerships. And we must, we ask you to come along besides us, just like we're now asking our clients to come along with us, as opposed to we're here to investigate, we're here to walk with you and figure out together what it is that we need to do. Very different piece based on the cultural safety, based on engaged healing, and based on what we know about trauma-informed care, and based on the fact that we are not police for the state, we're social servants. So how do we do that? Shift in the culture. And all of us need to move upstream. So we have increased our efforts around primary and secondary prevention, and we ask you to do the same. If you want to know more about the Prevention Collaborative, Christabel is here. I will ask my staff if they would put their emails on the chat, and I'll do the same in case you have some further questions that we cannot answer here. Thank you. Next. Next is Q&A. Could you believe it, Terry? Here it is. I did it so that there'll be time. Thank you all for listening. Appreciate it.
So I think we were hoping to drop some questions in the chat to get answered before we move on to the panelists. So if you do have questions that you'd like to have answered, go ahead and drop those in the chat. And if not, you can drop those in throughout, and Commissioner and her team can address those as well via the chat. Okay. So Commissioner Miranda-Straub, I really appreciate that presentation, and especially last week. We did get a question about slides being provided from the presentation. I assume we can send that via email. Perfect.
Absolutely.
Okay. That
anytime that I present, please feel free to share.
All right. We'll just give another minute or so. Okay. All right. So again, feel free to provide those questions in the chat, and Commissioner and her team can get to those. Right now, we are going to have a panel of experts from across the state kind of reflect on the last presentation and in this most recent presentation from today. I'm Sheena Nudi with Kentucky Youth Advocates. I never remembered to introduce myself, so I apologize for that. We have a panel of folks who are going to provide some insight and feedback based on what they do out in the field in relation to the Department for Community-Based Services. And we are going to start with, I'm just going to introduce who we have on the panel, and then what we'll do is get a little bit more information from each of them as they talk about how they partner with DCBS. So we have Kathy Adams from Children's Alliance, Tiffany Hall from Volunteers of America, Rick Wurth from the Children's Home of Northern Kentucky, and Melissa Goins from the Office of the Family Resource Youth Service Centers. So I'm going to open it up to all of the panel members, and you all can jump in, but I'd love to know, one, what your organization does and how you partner with DCBS. As we talk about workforce, what does partnership and working together with DCBS look like for you all? So anyone who would like to start.
This is Kathy. I don't mind starting. Again, I'm with the Children's Alliance. I'm not sure everybody knows what our agency does, but we're an advocacy and membership organization, and we have been advocating on behalf of our members and children and families for 60 years now. And it's a pleasure to be here with everyone. The Children's Alliance members partner with DCBS on every level that you can imagine, all the way to the front line, to leadership, and even approaching the legislature together when there are things that need to happen. So a lot of our members contract with the state to provide services that DCBS either doesn't have the workforce to provide, so we supplant their workforce, or we provide specialized services that they perhaps don't have the expertise to provide those services, like therapeutic foster care, residential services, etc. So we are very happy to partner with DCBS, especially during these trying times. I think we all feel the workforce crunch and the difficulty in hiring and retaining staff, especially on the front lines. We see that every day because we are right beside, hopefully, the DCBS worker in serving those children and families that DCBS serves, and hopefully in some way helping to reduce the workload on DCBS staff. Also, I mentioned that we partner at high levels. We partner with DCBS to streamline processes, to make policy improvements that benefit children, families, the DCBS staff, and also our members. We're currently partnering with DCBS and collaborating on the development of a new reimbursement methodology for private child caring and child placing agencies. And this new reimbursement methodology is key to ensuring the continuation of essential services, which also includes private providers being able to attract, hire, and retain necessary and essential staff. So again, we are just very excited. We have a long history of partnering with DCBS. And again, we feel their pain during this time, as the commissioner puts it, that they're hemorrhaging. It is certainly a difficult time.
I'm going to kind of piggyback on some of the things Kathy said. So I'm Tiffany Hall, and I'm the COO at Volunteers of America Mid-States, and we are a organization that does a lot of different services across the state, but really as it relates to our work with the cabinet, typically the most the service that kind of intersects the most typically is our substance use disorder program, specifically Freedom House, our residential program for pregnant and postpartum women and their kiddos. We are so excited. So two of the newest ways, again, we also have a very rich history and long history of working really well with the cabinet. One of the slides that the commissioner showed kind of made me think of two of the projects we're doing specifically. One of them, we're partnering together with our Family Recovery Court or Family Recovery Program in Clay County, and really are working hand in hand with the cabinet there to get families in to that program and help them understand and really see the benefit and see some hope. I think that's been the big sell for us and for the cabinet, is to be able to sell some hope to the families in that area. And then the October 1, so like in a few days, which blows my mind, we are kicking off our pilot project that will embed a therapist in a couple of different areas in the cabinet office, where we can really, the way we talked about it from the very beginning, is kind of a public-private partnership in a way where one of the few things that maybe the cabinet won't have to worry about as much as wearing the hat of substance use professional and substance use, knower, all things kind of expert. And so that's something we can bring to the table, obviously, and hopefully be able to go upstream and help get families into care before the removal happens would be ideal, but we're obviously going to be working in all situations. And so that's going to be an 18-month pilot. And we are working with U of L to do the research component of that. And Commissioner's been amazing and her whole staff to get that going. So hopefully more good results will come from that. But I think that is just a way of supporting the staff. That therapist will also act as kind of a offer some technical assistance and some training, and hopefully CEUs to the staff there in the office. So we can, offer that kind of win-win for people as well.
I can go next. So I'm Melissa Goins. I work with the Family Resource and Youth Services Centers. And I think most people know what FRYSCs are, but if you don't, our primary role is to reduce non-cognitive barriers to learning. So barriers to learning that are environmental in nature, it could be mental health, physical health, whatever is a barrier to learning in our schools. So we cover most schools right now. And I love that Commissioner said, child welfare is everybody, right? Because I really see FRYSCs on that continuum very clearly. In child welfare, we're more on the prevention side, but some of the things that we do to reduce barriers to learning, such as, setting up a support group for relatives that are caring for other relatives, engaging families into parents as teachers so they can learn about child development. We know that teaching about child development, adolescent development, is a protective factor for being in the child welfare system. So a lot of the work that we do is really the same as prevention. We are involved in the prevention work at the state level. And at the local level, I would say that our communication with DCBS at the very local level is a complete mixed bag, and I own that. I think what happens is that you have people that if they have been around for a while, if we have FRYSCs that have been around for a while and workers, DCBS workers that have been around for a while, they're better at communicating, but it's often an informal thing. They know each other and they know, oh, she's been there forever or he's been there forever. We can talk to them. And then that falls apart when we do have turnover. And I know I'm kind of dipping into the turnover issue, but the lack of a not formal structure, I think, is an opportunity that we have that I see. But we work with DCBS, regularly. I think some places we work better than others.
I'll jump in next. It's a pleasure to be with all of you this morning. I'm Rick Wurth. I'm Chief Executive Officer here at Children's Home of Northern Kentucky, CH&K Behavioral Health. And I just feel energized being a part of this group. It's so nice to be surrounded by men and women who have a particular vision of the world we want to live in, where the marginalized and the vulnerable are lifted up and included. So what a pleasure it is to be with all of you this morning. Children's Home of Northern Kentucky has been serving the poor and the vulnerable and the marginalized since 1882. We have 3 locations in Northern Kentucky. I'm coming to you from our main campus in DeVoot Park in Covington. We also have an outpatient hub in downtown Covington, and then we have a 58-acre campus in Burlington, Kentucky. And we have been partnering with DCBS for decades. We work with DCBS with our private child caring line of care. And we also offer psychiatric residential treatment facility care, PRTF services. And both of those treatment lines interact with kids who are being cared for by DCBS. I just had an incredible conversation with Mary and with Krista yesterday, Commissioner, and I just applaud the openness and the open communication that you and your team have for your providers. Everything that you had in your PowerPoint, Commissioner, could easily have been replicated for Children's Home of Northern Kentucky regarding our workforce. I've been here since 2010, and I have never seen the kind of challenges that we are seeing now with both attracting talent and retaining talent. And it has been daunting. But then again, one of the reasons why we adopted the sanctuary model for trauma-informed care was to navigate change, and the realization that change is the constant that we are dealing with. And as we navigate change, we are paying attention to the self model. That's how we navigate the changes that we're even talking about here today. What are the safety issues? What are the emotions at play? What are the losses that we have to freely confront? And only then can we get to the future. And right now, I have to tell you, for a provider there are a lot of emotions of frustration, of sometimes anger at not being able to seemingly do what's being asked of us with the resources that we have at hand. So it's not been a very pleasant moment, but yet our agency is being called to do the same thing that we're calling the young people in our care to navigate. We ask the young people in our care to navigate difficult moments, difficult chapters in their life, and to hang on to hope and opportunity. And so that's what we're committed to as we have this conversation about the challenges specific to workforce in our agency.
So let's dig in a little bit further to that when we're talking about what's working and what's not working, especially on the ground with that collaboration and connection. So we've got kind of the spectrum of folks on this call as far as like primary prevention to tertiary and really that healing piece. But like on the ground, what is working with the DCBS Workforce Partnership and what is causing some concern? What does it look like when it's not working? And that we can open it up to anyone. I think Melissa, you started to kind of answer that already.
Yeah, I was just gonna reiterate, maybe repeat myself, and then also just add a bit. But I think that we have places where there is a formal, monthly meeting that our FRYSC sometimes have with our DCBS workforce. And so that's, pretty formal, right? Like no matter turnover, no matter who leaves or who, comes and goes, it's a set time for us and DCBS to kind of just sit down and talk through the things. Because I think that if you're going to work in the continuum of child welfare, it's important to understand all the sides. And I think so much of this, is a lot of who does what. And I think we had a DCBS person that recently joined our workforce. So sorry about that. But they were in DCBS for 6 years. Okay. DCBS for 6 years. And they said, I had no idea all the worth that FRYSC could have provided. Had I known to kind of tap into that resource a little differently, I think there would have been better outcomes in some places. And so I think that is just very telling that oftentimes we just get in our lane and we say we understand the big picture, but really just kind of taking the time. And I know nobody has time. So I understand there's like different ways to make this work. But I think as formal as we can get of a structure, and maybe it's not a meeting, right? Maybe it's a formal process. Like our process is when we have someone that enters care, the first call that we make, is we touch base with these people, right? In these places. And we find out what services they've already had or, I'm not sure exactly how to formalize it without having just like certain things that I know about. So I think that is really, really important. And I think that is working well in some of our places. I think the places that are not working well are where they don't know each other. They don't know the role. They don't know what people do. And there's misconceptions about the roles, right? People say they don't do anything. How many times have I heard, well, FRYSC don't do anything. Well, DCBS doesn't do anything. Well, they don't do anything over at, the comp care or whatever, because people don't understand where we stop and start. And I think that's important, right? If we're going to have a whole system, then we all kind of have to understand where our roles lie and then identify gaps. And then together we can say, whoa, nobody does this piece. I thought you were doing it. And then we can say, oh, that's a gap that we have. So I'll stop there.
I think that's so well said, Melissa. I think for me, I think about our role in the consistency too of a person's experience, right? And so I know in some of the areas that we've worked with the longest, we have a pretty consistent experience. And then there can be another area where we'll have a county that we don't typically interact with. And it sometimes is a completely different experience. I think drawing some attention to that, having a conversation about that, and then being able to provide some consistency on our end, on the provider end for the person going through the process, right? And so kind of helping be a solution to that gap versus just pointing to it and saying, I mean, when we're talking about the workforce issues, it's not hard to see. I'm kind of surprised that there's not more gaps and inconsistencies. It always is impressive to me, the amount of, you know, agency memory that does exist, and some of that for people that have been there a long time. So I think helping, I know for me, being in an organization I just celebrated my 19th year at Volunteers of America, and it amazes me how often we have like a Groundhog's Day, at least once a year. I'm like, we just had this conversation, right? But then I realized my role in really being able to carry out the memory of that and provide some consistency. I think we can do some of the same thing as we interact with the cabinet and help people navigate that process and system.
I would say that two things that are really working well with the folks at DCBS and the folks here at Children's Home of Northern Kentucky, I'll name two. One of them is open communication. So that is huge, especially in moments that we're describing right now that are filled with fatigue and with challenges. Communication takes a lot of energy. And it becomes even more difficult when your energy is being sapped by trying to navigate some pretty awesome challenges that are facing us. But yet the team at DCBS and our team, I have never had a problem picking up the phone and getting hold of the commissioner or Mary or Krista. And so kudos to the open communication. I think the second thing that's going well is social learning. So here we are trying to respond to new challenges, and we are trying to work hand in hand with creating this 21st century DCBS. And nobody has the perfect blueprint, right? It's not just about following preconceived roadmaps that were designed by somebody else and then just implementing it. You know, we are not just the little hamsters that have to keep the wheel moving. We have to redesign a whole new game here. And so in terms of social learning, I think that things have been moving in the right direction. I think all of us are united with the commissioner, knowing that there is a need for this 21st century vision, and it's going to create some discomfort for all of us. I don't know of any change that doesn't create discomfort and grief and loss and anger and all of those difficult emotions. But I think we're in this learning process together. Those are the two things that I would highlight as going well.
And this is Kathy again with the Children's Alliance. I definitely echo what my predecessors have just said. Some very good comments on partnering with DCBS. But when I think of success, I think one of the bigger successes, in addition to our commissioner that is such a visionary and a leader, and the excellent leadership team she has in place, is the focus on prevention services. I can't say enough about how we have not been able to focus on prevention. Our focus and our resources have always been on the back end, after the abuse and neglect has happened. So this focus on prevention is just a breath of fresh air, and it is going to take us, and it has to be a key pillar or support of our 21st century DCBS, because when we focus those resources on prevention, we're keeping families and children together. We get better outcomes. We reduce caseloads on our staff. There's fewer need for services on the back end. And again, those services, while they're needed, and they will always be needed, those services in and of themselves often cause additional trauma for our children. So thanks to Commissioner Straub, the Family First Prevention Services Act, for allowing us to use 4E dollars for prevention and those front end services, so we can hopefully flip the system and keep our focus on the front end. I think it'll just do wonders to making a child welfare system in Kentucky that is better for children and families, and also will reduce the need for services and staff. So we're excited to be moving toward prevention.
Absolutely. And the vision for that, and what we've heard DCBS talk about is everyone needing to be a part of that too, right? Collaborating and bringing the C back for community. And we know that it's hard to get upstream and look at prevention when we are putting out fires. I want to talk a little bit about what you all see within your agencies on how your kids or your parents or caregivers or families are impacted by turnover as it is currently. And then we'll talk about solutions. Let's talk about what the impact of a reduction in turnover looks like. But what does turnover mean for your kids or your families? What does it look like?
I can jump in with some specifics, and I'll be vulnerable here. I raise birds. I raise exotic birds, parrots. And one of the difficulties of raising exotic birds is that if they're injured, they try to hide their injuries because they don't want to be abandoned by the flock. And so it's very difficult to know when one of my parrots needs to go to the doctor because they're wired to conceal their problems. And so I won't try to be a bird or a parrot today. I'll put my problems out on the plate. Our turnover rate is abysmal. It's never been this bad. I've been here since 2010. Right now, we're averaging our child care workers working in our 5 residential buildings, but we're seeing something like an average of a 15-week turnover. Folks are coming in, they're seeing the level of trauma. They are seeing a workforce that is fairly young and does not have the years of experience. They're seeing a workforce that hasn't been able to bond with our sanctuary culture because they've been here such a short amount of time. And there's drivers for that. The commissioner already mentioned things like fatigue and secondary trauma. The other things that there's economic forces at work, at least here in Northern Kentucky. Thousands of jobs are going towards the folks like Amazon and DHL. And so the people that we're losing are not going on to other places where they're doing similar types of work. They are leaving this type of work altogether. And so the high turnover rate, the lack of new applicants, and then trying to bond as a community, the commissioner mentioned, trying to offer these supports to the workforce. Those supports themselves have become very affected by the pandemic. So it's, some of the casual things that build community, right? We try to describe ourselves as a community of healing here. It's really hard to build community when you're not able to get together for our staff lunches and our staff cookouts because there was a fear of passing on COVID-19. And so we've gone now over a year with limiting those social gatherings for staff. I think between the pandemic, the economic forces outside of our control, and then the internal forces at work, they have combined to create a perfect storm that we're experiencing on multiple levels.
I think that that turnover, because we are in the relationship business in a lot of ways, which may be different. I've never worked at a big box store or something similar because I've always been in this field. So I don't know how important relationships are there. I will say that wholeheartedly. But I think that for me, being on the front lines, I learned very quickly that that relationships are really important. And so when you're in a role, a job that really is dependent on relationships, that turnover makes that complicated. When you have, somebody new in all of these key positions that you used to kind of know, who to call and who to ask and how to ask, and they'd get right back to you because they recognized your name. Just those simple things. And I think if anybody on this forum, if you spent any time working in a bit in a role, like I'm describing, you know exactly what I'm talking about. Like you felt it when you heard so and so was leaving, right? So why did you feel it? You care about them as a person, but also you're thinking, oh gosh, I got to start all over with someone else. They don't know me, they don't trust me. That there's just a whole thing, right, with that. And so I think that we all see that turnover is an important part of what is not going well. I'll say it that way. I didn't say that very well, but it's on if there was a scale, right, it would definitely be over here. Don't be over here. Not to mention the cost of, we all know the cost of training new people. The revolving door is just costly. It's just costly. So even if we are kind of already know that, the thing we don't talk about much because it's hard to monetize is the relationship piece. So I think when I think about our FRYSCs, that was the number one thing that I heard from them. It's we used to do that, but we don't anymore because there's new people and they just kind of stopped. Or we used to do that, but I don't really know who's over there right now. And we used to partner on this thing, and then now they don't, or maybe they don't know to come to the thing that's every month or whatever. And so I think that that's a part that's really hard to put a dollar sign on. Like we can put a dollar sign on turnover, and we can look at case outcomes, and we can look at cases that are heavier than they should be due to turnover. But that relationship piece is also an important part of this, especially in your rural communities. So
I definitely agree totally. It's the relationship piece that you lose and suffer. And when we're looking at change for families, which is at the core of what we are doing, but also change for the system. We have to have the ability to build trust and be able to build that relationship. And when you have turnover, it just disrupts everything in your ability to get anything done at the level with your family and your children. If they don't have a consistent case manager, if they don't have a consistent therapist, it just makes that change and where we want that family to get just so difficult. And then you multiply that when there's turnover between service providers because you're coordinating services and you don't know that the DCBS worker has left, and so there's another DCBS worker picking up the case. Well, they're already overworked. So it just compounds significantly what we want to achieve, which is ultimately change. And I've been I've been in this field of work for years and years and years, and so many times we have spent so many resources and efforts to put forth new ideas and to change the system. And so often the rug was pulled out from under us because the staff turnover. You can't ask staff to keep doing new and different things when they're treading water trying to stay alive. And so there's been so many things that we've wanted to achieve over the years that just the turnover in workforce sabotages it. So it's just the key to being able to get where we want to when we want change.
Ditto. Everybody said it beautifully. So very well said.
Kathy, I couldn't agree more. I mean, my image, and it's not a new image to me, but you hit the nail on the head. We can talk about change until the cow comes home, but it's very hard to change the tire on a moving car. And when you're trying to tell your workforce, we got to keep the car moving, we got to keep on doing what we are currently doing, and yet at the same time, blueprint a massive amount of change. Well, who does that? Sometimes our problems are not in the arena of like a nuclear physics level of problem. It's that we don't have enough players on the bench locally to do the work. And change is expensive, right? While we all want to transform the world we want to live in, one of the things that we cannot do is succumb to magical thinking. Things cost money. Change costs dollars, right? And sometimes, you know, the feeling, I try to plug into feelings a lot as part of our sanctuary culture here. You know, it's kind of like the Exodus narrative, right? Sometimes it feels like being a slave and asked to build a pyramid, but you're not being provided any straw or mud to make the bricks, right? And it's hard to point who's the Pharaoh in that story, because DCBS is also underfunded, right? So it's really hard to say, you know, who's at fault here for not providing the resources. All I know is that there is a tremendous cost associated with this kind of systemic change that we're talking about, because, you know, in some ways, if we're really wanted to be practical about this, if there is a greater emphasis on outpatient care, on early prevention services, why didn't that happen before in Kentucky? You know, it's not like we were clueless about the fact that that makes good sense. The fact of the matter is there wasn't a funding stream for it.
I am so sorry, Rick, but I need to interrupt you because I need to add the same piece about how our turnover is impacting clients. And I know that there's a solution question that was still there. So thank you all. But I want to just say that the largest threat, the largest impact that we're having as a result of the capacity in the workforce is twofold. One, the vision is threatened because it is really hard to get out of the fire, to sit under a tree and have some water, and then think of new ways to going back in. You may not have the right hose to kill that fire. So I want to say to the burden of leadership is that our staff may not be able to do that, but as leaders, we do need to step out of the fire, have a glass of water, and then bring water back in with new thinking about how do we solve this crisis so we're not here again. So I think that's the burden of leadership, that we don't get to say, well, I'm sorry, I'm just dealing with a whack-a-moles. I disagree with that. We're dealing with a whack-a-moles, yes, but as a leader, my burden is to keep the vision going at the same time and be able to come back with new thinking about how do we solve the crisis that we've had so it doesn't happen again. One, two, the biggest impact on our clients is that my staff is on triage. So they're only doing the child that is targeted, make sure that child and their family is okay, and then move on to the next one that's at risk. So all those other adjunct services to those siblings who need support, to those families that need support that are not in crisis and cannot be done as a result of being in triage. So the vision is threatened, and the ability to do that secondary level of intervention, as well as our communication with our partners, the continuity of care is extremely challenged and impacted, as well as our ability to document and have a consistent way that we build relationships, not only with you, but with our clients. These are crucial holes and gaps that we're having, that we're seeing that impact our client families. So thank you.
Absolutely, Marta. Yeah, we're on the same page there. My only point that I was trying to make is if leaders do step out of the burning house and we have our bucket and we have to go fill the bucket up, to use your image, what do you do when the well is dry, you know, or there's no body of water to go and bring those resources? I think that's the challenge you're facing and the challenge that the providers are facing too. I am not saying it's insurmountable, by the way. I'm just saying that sometimes the challenge is that the streams of water, the wells of water that we have been accustomed to funding, what happens when we have to experiment and find new ones?
So it sounds like that actually kind of points to a potential solution that you might recommend, Rick, is let's advocate to dig a new well or fill the well or make sure that we've got enough water. I would like, before we close out, would like for everyone to just give one way in which an advocate can help your workforce, whether it's your DCBS workforce, the workforce within your organization. One way advocates can help your organization or your workforce. I don't know if Kathy would like to jump in.
Definitely the first thing on the list is going to be advocacy for more resources. Child welfare has been woefully underfunded for years and years and years, and it's time that we put funding to adequately support our families and children with the focus on prevention, which costs less money. We can save more money in the long run, and unfortunately, everybody is going to be clamoring their legislators for additional monies because hiring staff and keeping staff is a barrier for everyone. So we have got to clamor louder than everyone else.
Reach out to your legislator. Tiffany, what about you?
I mean, I hate to say more of what has been said, but I mean, we obviously we need to be a positive narrative. I mean, we have to have a positive narrative about the experience, about working for the cabinet. I teach as an adjunct at Spalding, and I have a lot of the workforce there are people that will be potential, employees. And I'm always an advocate of the experience of having that experience. I'm like, gosh, what hard work, but what amazing work to say that you've had that experience first in social work. And so just continuing to be an advocate for that, and just be an advocate for pay. I literally just posted something on social just now about advocating for pay of our frontline workers and the people that work in the cabinet. We have to, I mean, there's so many ways to value people, but if we can't pay people, then the message immediately is that they're not valued. So we can do all the great things, but if we can't pay people a wage that they can't go get, obviously somewhere else doing much less hard, intense work, then we're just struggling. We're just going to be consistently in a struggle. So
yeah, Melissa, why don't you give yours, and then I'll kick it to Carly.
I would just say that our policy needs to reflect our values as a state, and that's money. I think also the messaging piece, I think that there's plenty of work for everyone to do around the positive narrative, and I love that Commissioner brought that up. Sometimes media focuses on the wrong things, and no one's saying it's perfect. That's not what anybody's saying. It's just we don't really tell the other side of the story.
Carly, can you take it away?
Can I just add one thing? I just wanted to say, we have $3 billion, I think, of American Rescue Plan dollars coming into Kentucky. And I think that could be one of the pieces of our solution in terms of finding these additional wells. How do we advocate that some of those billions of dollars with the American Rescue Plan is actually coming to help us retool and recalibrate the work that all of us are engaged in?
Resources for sure. Carly, why don't you take it away?
Thanks, Shannon. I'll be super quick. I just want to, again, thank our panelists for providing your all's reflections and feedback today. Those partner perspectives are so important. And a special thanks to Commissioner Straub and team for providing us with some context and listening to feedback and answering questions. This conversation is so important. We also want to thank Aetna Better Health of Kentucky for their support of today's Advocate Virtual Forum. Looking ahead to next week and the week after, so in lieu of an Advocate Virtual Forum next week, we're actually inviting folks to join Bounce Coalition's virtual Grand Rounds event on September 29th at 10 a.m. So it's at the exact same time as our typical Advocate Virtual Forums. We'll be discussing supporting foster youth and families who have struggled with adversity. So it fits really well with this conversation that we've had over the past 2 weeks. The following week, we'll be back with a forum discussing supporting parents and families with babies. So as always, the follow-up email will include a recording of today's forum and any resources we discussed during today. So I just want to thank you all again for joining us and hope you all have a great rest of your day.